In the year 2020, the world witnessed an unprecedented challenge, the COVID-19 pandemic. It brought with it an air of uncertainty, fear, and change that affected institutions and communities worldwide. Lagos State University, a beacon of knowledge in Nigeria, was no exception. LASU, like educational institutions worldwide, had to adapt. They transitioned to online learning, ensuring that education continued despite the challenges. Faculties and students embraced a new way of teaching and learning, making use of technology to bridge the gap.
The COVID-19 pandemic affected my daily life as the regards that we had to go on lockdown and I could not be in school for like the first semester of my first year of university. So I got used to online classes, WhatsApp classes, and it's kind of affected the students, the classroom interactions a bit. The compulsory face mask, the washing of hands at every center, and I think that was really effective. The fact that you had to wear your nose mask before coming to school and even in classes, although the implementation was quite shaky, but was really effective as regards to able to control the spread of COVID-19 in campus. And thanks to God, we never had an outbreak in like Lagos State University. Yes, I did get vaccinated around Lagos State University, and the vaccination effort was quite stressless compared to every other thing in school. So it was really, really was stress free. I could get vaccinated easily. In fact, I just had to do it on my phone. I was given a date, then went to the school health center, and it was haggle free. Was quite easy to get vaccinated.
Well, the COVID-19 pandemic for me it wasn't really a problem per se. I just had to stay at home and I was able to study at home, yeah. So most of the things I was doing were like remote. I tried online courses, certifications, and attended classes virtually because my school was able to adapt to it. So that was how COVID-19 was like for me. So my school, Lagos State University, was able to conform to the worldwide measures set in place for the prevention of the spread of COVID-19. What we had was we had taps and sanitizing stations installed across the school, and then we engaged in active social distancing. That is, we kept spaces in the classrooms. We also adapted a hybridized system of learning. So some classes were virtual, some classes were physical um, to ensure that like meeting physically was reduced to the bare minimum. So that those were the measures that I can recall. Well, as for me, I wasn't aware that there was a vaccination process ongoing in school. What I did know of was that they tried to conform and all, but I feel like generally the vaccination was good for those who believe in it. I just believe in taking good old fashioned agbo, so that's what I did. That's what I took, and well, I'm okay.
So the COVID-19 pandemic affected my life as a student due to the fact that we were unable to receive direct lectures from our lecturers. So we had to stick to the online virtual lectures. So though to some extent it was effective, but it's really affected because we were unable to have normal interaction in classes and all that. So it's affected in one way or the other. Yeah. Some measures that were actually taken by the school, by Lagos State universities, like washing of the hands before coming inside the school, then using of your nose masks, and during the exams, we were asked to get a hand sanitizer and our nose mask before entering into the exam. And to some extent, the measures were really effective because there was no outbreak of COVID-19 pandemic in the school. To some extent, I think some students were able to get vaccinated in school because there were measures put in place by the university's health centers for students to get vaccinated. And I got vaccinated. I took a dose of the vaccine, but it actually reacted on my body, like my hands. I felt pains, and which actually discouraged me a bit from taking the remaining doses.
My name is Dr. Yusuf Khadija. I'm an assistant lecturer at the Lagos State University Faculty of Communication and Media Studies, Department of Public Relations and Advertising, precisely. A big bang for everybody. This is not even only institutions that were affected, families, individuals, organizations were all affected. And then, when you are hit by a pandemic that you don't prepare for, you need to start thinking of, ways that you can adapt. And, as Nigerians, we adapt to things easily. Things don't get to us that much. And so it was easy for Lagos State University to come up with the idea of having online classes for our students. You know, when you leave your book for so long, whatever knowledge you must have acquired for a period of time will probably leave you if you don't, revisit some of these things. And so coming up with online classes was a good idea. However, Nigerian factor, data, connection issues. Some of our students don't even have Android phones that can, connect to some of these things. But starting that was a good step in the right direction. So having online classes with our students allowed us, to be able to cover up for the missed time. I think the pandemic was for like the lockdown was for more like a month or almost 2 months, and then we had to now start doing social distancing, and we still had to use the online classes. So starting with that was a step in the right direction. At least we're able to cover up for some of the missed times that we would have had when the pandemic was still very hot. In terms of quality, if you'd ask me, I'd like to be sincere with that. Most times physical classes, there's no way we can undermine it, especially in a country like Nigeria. We're not like those in the abroad, in quotes, where they're already used to this system. When you're introducing something, to take a while before people would adapt to it. And then you don't have any control over how the students will get to understand whatever you are teaching them. Yours is just to teach. Sometimes some of the students don't even use their videos. They only just come online and then you see their names. So you don't even know whether what you're saying is even flowing. You don't even know whether they have an understanding. From physical interaction from their faces, you can actually even see whether what you are saying makes a lot of sense. In terms of quality, let me say in terms of rating the quality of this transition, I probably say 40% quality is what you would get. But over time, if you continue such a system and then giving more materials before you're having these classes so that the students are already, familiar with what you're about to teach, it makes it more easier. But for now, I put on a scale of 40%. When we resumed after the lockdown and we're supposed to do our social distancing, so I think the school came up with the idea of putting stickers on the chairs to show where to sit and where not to sit. Of course, the face mask was a thing. In fact, that was a thing for almost like a year. Then the issue of sanitizing at the gate before coming in. I think each of the faculty had wash hand basins and then sanitizers where you would have to use before going into these halls. I don't know how much students are dead to them, but I know for a fact that in Faculty of Communication and Media Studies, sitting down, very close was not a thing. And so, in fact, we even had to do classes in batches so that, when this group is done or when this exam is done, another set, comes in and all of that, just to make sure that the spacing and then making sure that nobody contacts the COVID-19 virus. Even the health center was also a part of all the faculty exams. So we have our temperature checker and all of those to make sure that we are following the COVID-19 prevention measures. So I think those ones were in place, and at least we thank God. I don't think we had any casualty concerning COVID-19 throughout that period. Adapting to something new it usually takes a long time. Some people will adapt very early, but they are usually just like the minority. Some, they would want to adapt, but maybe some particular factors like maybe no light, no data, and all of that might, hinder them from adapting. Then some others, maybe what's it called? They don't just want the idea of doing anything online. They still want to remain in that realm where people go to class and all of that. But it's not easy to just move into that sphere of online classes just like that. We have to do it step by step. It's not a thing you do one off and then you know that no, no. Even when the pandemic is over, we are still trying as much as possible to, try and adapt that online classes with our physical classes, just to make sure that we are following the world in time. Then it was really difficult even bringing all the students together. Sometimes you have lectures, online lectures for 2 o'clock. A class of 400, you probably see 150. Still, that would take me back to quality. That way, you would not know whether others are following or not. And then by the time you would resume, you still have to repeat some of the things that you have done online. You would have to repeat them again. So, but I think even now that the pandemic is over, we're still trying as much as possible to infuse the online class so that in case there's another pandemic that will require us to be inside, we're already used to this type of teaching practice. There was a website, or an app that was created also, that you would first record, you do a PowerPoint and then you record your voice on that PowerPoint. So for those that cannot do, Zoom for a long time, the measure that what we did was, so you would record, you would do your PowerPoint, you record your voice, and then convert it and send to the students on their WhatsApp platform. So in case you cannot do Zoom for so long, that also helped. So aside from this had nothing to even do with giving us any form of a gadget or whatever. Each lecturer had to use their own laptops and phones and internet, obviously. However, by the time we resumed, some palliative little by little was given to the lecturers. Might not be sufficient. However, the job comes with the passion. And when the passion to teach and impact is there, you might not necessarily be bothered about whether a palliative was given or not. Yours is just to teach. And so I think we were able to manage. That's just the word that I would like to use. We were able to manage during that period. And I think there was a set that graduated even during that pandemic period, and they are done with school now. So we're getting there.
LASU also played a critical role in the fight against COVID-19. The university engaged in research, provided testing facilities, and offered support to the community during these challenging times.
Hi, it's Adeniyi. I'm one of the medical officers here at Lagos State University Health Center. How did the COVID-19 pandemic affect the healthcare system here in Lasso? I think it's the effect of COVID-19 was universal. It took everybody by surprise, and it has forced pretty much every system to become more aware about about transmissible diseases and those basic things that we do to prevent them. Even now, we are more conscious about respiratory illnesses in general. Not COVID is no longer an issue now, but we still pay a lot of attention to respiratory illnesses. So if a patient comes in coughing, sneezing, we are more careful about trying to break that chain of transmission and about educating patients about things to do to limit the spread of respiratory illnesses. So it has had that lasting effect. Also, during the pandemic, there was a lot of effort put into being able to isolate and quarantine patients, which again, then it was specifically for COVID, but it's not just COVID. That there are other illnesses that we need to that require isolating patients. So we have become more tuned to that and be able to do that better than we used to. Well, in last week here, what are the biggest challenges that we faced? Well, there was a lockdown and we still had to come to work. So that was that problem. Right? It wasn't quite easy. Fine, it was maybe relatively easy for some of these members of staff that had vehicles, but for a lot of other people, it was quite challenging. Like having to, yet you still have to show up to work. Right? Everybody showed up to work. So we, whilst other people on holiday, still have to show up to work every day, and the working conditions were more strained. Right? You didn't have as much hands. Yet to see as patients. So that was that. What else would I say? Sorry, what was the question again?
In your opinion, what are the biggest challenges the health center professionals face in the fight against COVID-19?
Okay. I guess the other problem is the other challenge that we had to face was the resources were limited. Right? It's even in the teaching hospitals, there was the big scare of every patient that has COVID being an illness that the symptoms were not always very specific. It meant that for every patient that came in, you had to be on high alert. Yet, you didn't really have, there wasn't that much more that you could do for them, right? So we had a few scares, we had a few patients that we had to refer, and knowing that, especially in the early parts of the disease, there was doctors were dying, and you are treating patients, and you know that being in the hospital that puts you in the line of fire. If you were to get this disease, there isn't anything there isn't much that can be done for you either. Later on, there were vaccines, there were things that could be done, but early on, it was quite scary. So, but we still had to show up to work. So, dealing with that, that emotional burden was quite straining for pretty much everyone. Well, it went pretty smoothly once vaccines were available. Vaccination is not a new thing, right? COVID vaccine was new, yes, but vaccination drives were not new. So it was very easy to right. It was very easy for us to create a system that works effectively. Well, I would I would I would credit the nurses in that department. Like they are very well versed when it comes to vaccination and organizing that, and we partnered with OJO Center in doing that, in achieving that. So it was quite smooth. Well, I'm sure there were not. I don't have all of the knowledge on that, right? But there was, yeah, there were a lot of partnerships with organizations, but I'm not sure I can answer that question with a lot of detail. So,
Okay, sir.
yes, I mean, like Nigeria was very lucky in general. So, but yes, in LASO, we didn't have any. Overall, fine, we were prepared. Yes, we did the best we could, but the lockdown helped. So it minimized the number of cases that we would have had. We didn't have any mortalities. Yeah, we didn't have any mortality. It was fine. It went well. Okay, turnouts for the vaccination. I don't have the actual numbers, right? Because I don't work in the records department. I've not really been curious enough to check, but rough estimates in my head, yes, I think the turnout was actually quite good. I think apart from the few people who were maybe worried as well about vaccination, most people wanted to get it and they were able to get it. So we didn't have cases of people who they wanted to have it, but then the vaccine wasn't available. It was a lot of people turned out and we were able to make the vaccines available for them. So turnout as far as not completely factual information in my head is concerned was decent. So we didn't have low numbers. We're not looking for people to come around for vaccines that were just lying there.
My name is Dr. Shueton Oladipupo, a senior medical officer, Lagos State University, Ojo. It is important to note that the effect of COVID-19 did not actually affect the university system only, but affected the whole country, the nation, and it's even a worldwide challenge. In a nutshell, the COVID-19 had a very devastating effect, specifically, on the educational system all over the country. The student could not access their education. At the earlier stage, some of the lecturers was even trying to use, the virtual learning and all that. But of course, considering the review of the government as regards the COVID-19 policy, at the point that we needed to stay home for like some few weeks, and over time, weeks turned to months and all that. So the student could not access the healthcare. Even those with the doctors and other health workers kept struggling to come over, and the few patients we saw um, was um, was well taken care of. However, it was a very big risk on the doctor itself. So in a nutshell, the university did their best to curtail the little they could. A whole lot of challenges was being faced by the health workers during the COVID-19 pandemic. Um, One of the things that was a major challenge was the health worker itself being non-availability of equipment, of some items. For instance, there are something we call the PEP. They are like personal, equipment to protect one from some infective diseases. In likes of COVID-19, you are supposed to have a face mask, a gun, and some others. In some centers, you know, there were no provision of such. So it was actually a very big challenges. A very big challenge. So at the point, some of the doctors, we thank God that we never recorded any case of a doctor contracted with the COVID-19 here in Lasso. But in other state hospitals, we had cases. So it was really a big challenge for them. But the doctor that was, the few doctors that was ready to take care of the sick, eventually themselves got, sick, and we lost some doctors in this process. So it was really, a tough time. Well, the vaccination of COVID-19 actually came smoothly for the Lagos State University. The staffs and student inclusive. We were able to liaise with the local government area or Joe, not far from the university. There was we liaised with them, and luckily we were registered as part of those that could give vaccine to people. So we got registered, and a whole lot of people benefited from the vaccination, the staffs, the students, and other people that are not even staffs or students, outsiders, actually came to get vaccinated in the premises. So it was actually a smooth ride for us. We had no challenges with the vaccination. Well, as form of collaboration, basically for COVID-19, there is the center that takes care of it is the CDC, the Center for Disease Control. So there's a policy, there's a guideline, there are advocates that have been put in place. So I believe that every center do have to follow the protocol the CDC had put in place. So you seen someone that is COVID-19, positive. There are steps you need to take. You need to inform the right bodies, collect samples. You see some sense and all that. So in a nutshell, when you see anything, there are bodies you need to inform. There are appropriate channels you need to follow as regards. That. Thank you. Yes, I would say it was indeed a successful. Fight. The university in its little capacity tried their best. Um, there were, motivations from the management. I think the vice chancellor then, Professor Fagbon, did his best, for the health workers here in the university. Then he, at the point I could remember, he came, visiting us during those periods just to give us some moral support, and he could appreciate the work well done we were doing those times. So um, by and large, the university was quite. They took cognizance of the fact that we did the best, and the university was highly supportive during this period. So the vaccination turnouts now, yeah, at the onset, I would say the turnout was massive. People came, the staffs, students, a whole lot. We had a lot of people that came for the vaccination, and however, over time, complacency set in. People, were not coming as expected. I think when we started with like about we were practicing for like I think 4 days a week. Over time, we reduced to two. Then at the point, I think we stopped. And the reason we stopped was there was a closest center to us, which is Ojo Health Center. So patients that comes, the few one that was still coming during those period was referred to the Ojo Health Center for vaccination. But the turn up was massive at the onset, and over time it reduced, and they continued there at Ojo local government. Thank you.
The story of Lagos State University during the COVID-19 pandemic is one of resilience adaptability, and the unwavering commitment to the education and community. As the world heals, the legacy of last year's response to this crisis will be remembered for generations.